Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Depression mainly affects three parts of the brain. The first is the hippocampus, which is located near the center of the brain. The hippocampus stores memories and regulates the production of a hormone called cortisol. The body releases cortisol during times of physical and mental stress, including during times of depression. Problems can occur when excessive amounts of cortisol are sent to the brain due to a stressful event or a chemical imbalance in the body. Causes of depression include, but are not limited to, abuse, some prescription drugs, experiencing grief or loss, genetics, major events, personal problems, and also substance abuse.
Depression has various symptoms, including but not limited to sadness, hopelessness, guilt, moodiness, angry outbursts, loss of interest in friends, family, and favorite activities, trouble concentrating, making decisions, and remembering, thoughts of harm or suicide, withdrawal from people, tiredness, lack of energy, changes in appetite, weight gain, weight loss, irritability, and restlessness. People suffering from depression may experience insomnia and have unexplained aches and pains. Delusions or hallucinations can also occur in severe cases of depression.
Forms of treatment for depression include medication, psychotherapy, and hospital or residential treatment. For medications, doctors often begin by prescribing selective serotonin reuptake inhibitors, or SSRIs. Other common medications include serotonin norepinephrine reuptake inhibitors, or SNRIs, norepinephrine dopamine reuptake inhibitors, or NDRIs, atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors, or MAOIs. Psychotherapy refers to speaking with a mental health provider about your condition or other related issues in order to help lessen your depression. Psychotherapists can help provide patients to identify and deal with their emotions and to find new healthy ways to cope. If a patient becomes unable to care for themselves or if they become a danger to themselves or others, hospitalization and residential treatment are necessary. These programs provide the outpatient support and counseling needed to get symptoms under control.
There are many warning signs associated with depression. Starting with the emotional and behavioral signs, these include irritability, a lack of energy and motivation to do everyday things, which also leads to a loss of interest in previously enjoyed activities. Reckless behavior is often exhibited as well because the person may not value their life or see the meaning of consequences. Physical signs are often overlooked when identifying depression, but they are just as relevant and common. These signs include chronic pain, headaches, fatigue, a loss or increase in appetite, and changes in sleep patterns. When any of these signs are prolonged, they are considered to be warning signs of depression.